morning. I'm Brooke. I'm going to be your nurse today. I've got a couple different questions I need to ask you. How are you feeling today?
Good.
Any problems? Any complaints?
No.
All right. Let me see your name, Ben. Good. And can you show me your name and date of birth?
Julian Baker, 12/26/1983.
All right. I've got a couple of silly questions I need to ask you. I have to ask them to everybody. Can you tell me where you're at?
EKU.
All right. And do you know what year it is?
2010.
All right. So appropriate affect, mood, orientation times 3. Going to move on to her skin. Just need to look at your wrist. Good. I know that the skin is clean, warm, dry, pink, and I would test her skin elasticity with her turgor, and it's elastic. I'm done with that skin assessment. I'm going to go on to the hair. Note that she has brown hair, fine texture, moderate amount, and evenly distributed. Any difficulty with your scalp? All right. I'm going to go on to your face, into your nails. Can I see your hand? Nails are pink, wrist capillary refill, and adhere to the nail bed, and they are clean and well-rounded. Good. All right. I've got to make you do a couple funny facial expressions, so just do as I do. Can you smile? And can you frown? And can you show me all your teeth? And can you puff your cheeks? Good. I'm going to need you to close your eyes. Good. Now raise your eyebrows up. Good. Now close them together, squint, and don't let me pry them apart. Good. So her cranial nerve 7, her facial nerve is intact. We're going to move on to cranial nerve 5. Can you puff your cheeks? Good. Sorry, that's cranial nerve 7. Sorry. Can you clench your teeth? Good. And the masseters are even on both sides. And I'm going to do something else. I need you to check sharp and dull for me. I've got a Q-tip here, and I need to use your hand to see which one is sharp and which one is dull. Can I see your hand? And can you tell me if this is sharp or dull?
Sharp.
Good. And sharp or dull?
Dull.
Right, we're going to do this on your face. Close your eyes for me. Sharp or dull?
Sharp.
Good. Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Good. Cranial nerve 5 is intact. Alright, we're going to move on to palpate your sinuses. Any tenderness on the frontal sinuses and the maxillary?
No.
Alright. Let's move on to the eye exam. Can you close your eyes for me? Eyebrows are evenly distributed, no drooping on the eyelids. Eyelashes are evenly distributed and dark in color. Can you open your eyes? Sclera are white. Conjunctiva are nice and pink. Pupils are approximately a 5. I'm going to slide this across your eyes. Just keep looking straight at me. Good. Pupils react together to approximately a 3. Both eyes did that when I went across with the light, and they did it a second time as well. So pupils are equal round and reactive to light. Can you see my pen light? Good. And as I go in, her eyes converge and they also accommodate. Alright. I'm going to note that the light reflex on her eyes, or the Hirschberg, is at about 1 o'clock on both eyes, and that's equal. I'm going to cover your eye. Good. Good. No significant findings on the cover-uncover test. We're going to move on to her ears. Sorry. I'm going to do the 6 cardinal directions. Follow my finger, please. And I'm going to do her right eye. So 6, 3, 4. Good. All right. Now I'm going to move on to her ear exam. And I note that her ears are equally set on both sides and in alignment with her eyes. Test my light. And I'm going to do her left ear. I'm going to pull up and backwards. Have you had any tenderness in your ears?
No.
And her external canal is nice and pink. No flaking or tenderness. Notice that it's in her ear. And look at her cone of light. Her short process of malleus, the umbo, and the handle of the malleus. Okay. Alright. We're going to test your hearing. I'm going to hit this against my hand and place it on your head, and you just let me know which ear you hear it in. Good. Alright, I'm going to hit it again, and I'm going to place it behind your ear. You just let me know when you stop hearing that, and then I'm going to place it in front of your ear, and you let me know when you stop hearing that. Okay, good. Okay, okay. Air conduction is 2 times bone conduction, which is good. Alright, and can you occlude one of your ears for me? Okay.
77.
Good, and the whisper test, and I would complete all these exams on both ears. Alright, I'm going to go on to the nose. Note that her nose is in alignment Have you had any tenderness with your nose?
No.
Can you include one nostril for me and take a breath? And now the other side. Any difficulty breathing through either nostril? Okay, I'm just going to press up on your nose. Nice, pink and moist, and hair-like structure's intact.
Did you look at the position of where yours in the symmetry?
All right. Now I'm going to go on to the mouth and throat. So can you show me your lips? Lips are pink, evenly distributed, and open your mouth. Show me your teeth and your gums. No caries noted. Teeth are white and evenly distributed and clean. Open your mouth. Good. Say ah. Ah. Cranial nerve 10 is intact. Uvula motion. Hard and soft palate's intact. And tonsils intact. And lift your tongue. And no significant findings underneath your tongue. Just a nice piece of chewing gum. All right. I'm also going to verbalize how to elicit a gag reflex. I would use a tongue depressor. And I would explain to the patient that I'm going to take it, and while she has her mouth open, press it on both sides towards the back of her throat until I elicit a gag response, and I would use both sides to make sure that the cranial nerve 9 is intact on both sides. All right, now we're going to move on and do your tongue strength. Can you press your tongue against my hand? Good. And the other side. Cranial nerve 12 is intact. All right. Let's go on and do the neck and your range of motion of the neck. I'm going to palpate your lymph nodes, the submental, submandibular, tonsillar, preauricular, postauricular. Can you tilt your head forward for me? Occipital. Good. Back up. Posterior, superficial. Can you tilt your head to one side for me? Deep cervical on the other side. And no significant findings on the lymph nodes. Can you shrug your shoulders? Supra and infraclavicular, and no significant findings on any of those. So good. I'm going to need you to do the things that I do with my neck. It's just a couple exercises. Can you bend your neck down? Good flexion and extension and backwards. Hyperextension. Any pain?
Yeah.
Okay. Lateral flexion and the other side. Good. And rotation. Good. All right. Can you press your shoulders up for me? Good. And press your hand against mine. And this side. Good. And that's cranial nerve 11, and those are intact as well. So we're done with your neck exam. We're going to go on down to the posterior chest. So I'm just going to have you slide a little bit to the side for me. Good. Just going to look at her chest first, or look at her back first, to make sure that I don't find any deformities on her back. Take a deep breath. Good. So I've auscultated 14 places on her back, and I'm going to percuss. Listening for any abnormal sounds between the scapula and the spine. And working my way down in a ladder motion. Good. All right, so now we're going to work our way to the anterior chest, and I'm going to look to see if I find any deformities on the anterior chest or any labor breathing, and there are none. Just take a couple good deep breaths for me. And no abnormal findings there either.